On the website of the Crime Bureau of India is posted a crime clock. The clock states that in India, one rape is committed every 29 minutes. The clock never stops ticking, nor do the rapes.
This is a true illustration. A girl was brought from a village to a city for domestic work. She was sold to a brothel. She was recovered during a raid on the brothel. On medical examination, it was found that she had been physically tortured and her genitalia had been dilated with tampons to adjust to disproportionate male organ. She also showed old healed hymen and tears in the vaginal wall. She was tested positive for gonorrhea and semen traces were also recovered from stains. An age determination test corroborated she was just 12 years.
The crime clock on the website also reveals that a case of sexual trafficking is registered every 40 minutes. A young girl is imported for commercial sexual exploitation every fourth day. It is the beginning of repeated sexual assaults on the adolescent. The number of sexual assaults on her rise with every passing hour. Social scientists make 4 points. The statistics reported by the Crime Bureau are just the tip of the iceberg. Owing to guilt, shame, cultural compulsions and poor knowledge of law, very few cases of sexual abuse are disclosed and reported in our country. It is a fact that both rape and sexual trafficking cases are on the rise. In our land, conviction rate of rapists and sexual criminals is very low. Varying from state to state, only 20 to 30% of the accused get convicted and punished. There is a relationship between conviction rate and sexual crimes. Higher conviction rate can help in the prevention of sexual crimes and trafficking. Doctors are the most crucial link in raising the conviction rate. In all the sexual abuse cases in the court of law, the evidence collected by the doctors through medical examination of the rape victim, the age determination test, and the medical legal report play a key role in deciding whether the offender will get convicted or not.
All of us are clear that to prevent rape and immoral sexual trafficking, the conviction rate must be raised in our country today. The right legislation is in place. What is needed is medical evidence that goes in favor of the victim in the court of law. As the nodal agency for controlling trafficking, Indian Medical Association is committed to raise the conviction rate and to get justice to the rape victims. Indian Medical Association's approach is bilateral. It is seeking the government support to establish rape crisis centers in the entire country. At the same time, it has taken up steps to equip the medical officers with the skills required for providing accurate medical evidence. This film is a part of that process. Through this film, my colleagues here, Dr. Sunita Potedar, Senior Specialist Department of Gynae, Swami Dayanand Hospital, Shahadra, Dr. Sangeeta Gupta, Head of the Department of Gynae, ESI Hospital, Basai Darapur, and Dr. Gaurav Agarwal, the former Assistant Professor, Vardhaman Mahavir Medical College and Safdarjung Hospital, will take you through the entire process of medical examination through a standard protocol to be followed throughout the country.
Standard Protocol for Medical Examination of Sexually Violated Adolescent Girls is a film presented by Department of Women and Child Development and Indian Medical Association. Elimination of sexual abuse and trafficking of women and children for sexual exploitation is a key priority area for the Department of Women and Child Development. The department is studying the problem in greater depth and collating data. It is building awareness in civil society and NGOs. It is advocating national legislation at par with international and regional instruments for eliminating trafficking. This film is a part of the larger goal of the department. The film will now instruct you on how to conduct a state-of-the-art examination of a young female sexual assault victim. It is divided into 4 parts: medical forensic examination with in-depth explanation, age determination, how to access technical support from Indian Medical Association, summary of forensic examination. The film has the following learning objectives: to introduce a standard kit with all the tools required for medical examination, to learn proper method of conducting the forensic history and physical examination, to learn proper evidence collection techniques, to learn the right procedures of age determination, to learn the prophylactic regimens to prevent disease and unwanted pregnancy, to know where to access technical information on forensic medical examination. This here is a standardized kit being demonstrated by the Indian Medical Association. The standard protocol for forensic examination consists of 14 steps. Accordingly, the kit contains a set of 14 packets. Each packet represents a particular step in the process of evidence collection. Therefore, the packet and the step carry the same label and number. This design of giving the same number to the packets and the steps will ensure that all evidence is discovered, collected and preserved without mistakes and without leaving out any important detail. In some cases, you may not need to use all the envelopes of the kit. For example, if no debris is found on the body surface, the packet of debris will not be used and no specimen will be written across the label. In other situations, you may need extra supplies in the form of needles and oral swabs from the hospital stores. For successful forensic examination, you must do the following: pay a thorough and close attention to details. Wear gloves at all times. Touching the victim, the kit, or its contents with bare hands may leave your DNA in the evidence. Wear powderless gloves if possible, since the powder may interfere with the laboratory examination. Moisten the speculum with warm water, not with lubricating jelly, as the jelly may interfere with forensic tests. Before the examining physician comes, let a trained nurse calm and reassure the young victim. Building rapport with the victim is crucial. Otherwise, the victim will be hesitant to talk, making her own case weak. Let her explain to the victim gently what the medical examination is all about and its importance for the trial. Remove her fears about the process she is going to go through. This is a very important and critical step. Let the paramedic staff give the victim undivided attention for a few minutes. The step 1 is to get the legal consent form signed. The doctor must take the legal consent before she begins the evaluation. Please explain to the victim what the consent is for, why the girl must sign it, and how it is going to help her get justice. Consent must be taken in the victim's native language.
Legal consent is a must in every type of medical legal case, be it a police referral, be it a direct request of the victim or her guardian for a medical examination, be it a rape case or a case of sexual trafficking for commercial sexual abuse.
It's important that the physicians and the paramedic staff's attitude be non-judgmental. It is a commonly held prejudice in our culture that the girls who get raped are the loose and bad sorts of girls who who invite it.
उसकी तैयारी
Inquire
करते हैं।
within and make sure that this is not the attitude you or your staff holds. Such an attitude, if harbored and communicated, will create negative feelings and the victim will become uncooperative. Make sure that the examination meant to help the abused child doesn't itself become a source of distress for her.
अच्छा,
Second, as a physician,
सारे लोग थे
it is not your responsibility to determine whether a rape took place or
परेशानी
not.
हुई?
Your responsibility is only to carefully examine the victim, collect the
कभी
evidence,
किसी और तरह की
and document the findings.
लोगों ने चोट भी मारी।
Never comment whether a rape has taken place or not. Rape is a legal term, and only a court of law can comment upon it.
बेटा, अब मैं तुमसे कुछ सवाल पूछूंगी। पहले ये बताओ, ये हादसा कब हुआ?
Now the next step is to start filling the examining physician's report. The first page is a detailed history form. It is not all inclusive, but covers most of the questions which need to be asked about the victim. At the bottom of the form is the section where the results of the examination for spermatozoa are recorded. It also has a page with a body diagram for sketching injuries such as contusions or lacerations.
इस सारे एग्जाम
Be aware that some victims may not understand medical terms.
ये जो सब
It is sometimes necessary to describe body parts or specific sexual behavior.
तो ये हादसा तुम्हारे साथ कल रात 10 बजे हुआ। अब मुझे जरा सोच के बताओ कि उसने तुम्हारे साथ संभोग किया, मतलब अपना अंग तुम्हारे अंदर डाला?
Occasionally, it may be necessary to use more explicit or even slang terms to ensure the victim clearly understands the question.
उसने स्खलन भी किया? समझते हो इसका मतलब? पानी अंदर छोड़ना, उसने पानी छोड़ा?
Ejaculation may occur within the vagina during the assault. However, semen may be deposited on the victim's skin or clothing. Proper examination of all the three is necessary to not miss the evidence.
क्या तुमने उसके बाद कपड़े बदले? नहीं बदले। उसके बाद तुम नहाई हो? नहीं नहाई।
A common misconception is that douching or bathing eliminates the ability to collect evidence. Actually, seminal fluid will often be recovered from the vaginal and cervical mucus, even if douching or bathing has occurred.
ठीक है, अब तुम ये कपड़े उतारोगी क्योंकि ये कपड़े आगे जांच के लिए जाएंगे। सुरजीत, तुम इनके कपड़े उतारने में मदद करोगी और ये सारे कपड़े हैं संभाल के रखोगी और इसको एक गाउन दो पहनने के लिए। ले जाओ तुम इन्हें।
The victim's clothes must be carefully collected and placed in the evidence bag labeled Step 3, Outer Clothing. The underclothing is kept separate from the outer clothing to prevent contamination. Prior to the examination, take 2 steps. Remove a chocolate agar plate from the refrigerator and allow it to come to room temperature. This would help the process of obtaining reliable culturing. Second, prepare the slides that will be required to be used in Step 9. This will save time when the speculum is in the vagina. Finally, prior to beginning the examination, the appropriate size speculum should be chosen. Most of the times, a medium-sized Cusco speculum will be appropriate because of its narrow and flat blades. Now we resume the physical examination, that is Step 4. Usually we don't find multiple types of debris or stains. However, if more than one type of evidence is found, you must use a separate packet for each. Debris found in the pores of the skin is often an important link to the crime scene and the assailant. The entire body surface should be examined from head to toe for fibers, leaf matters, and so on. Remember, it is imperative to place debris from each different site in a separate packet and mark accordingly. All the envelopes in the kit are self-sealing. Never moisten them with saliva. If a struggle took place, the outer layer of the skin of the assailant may be trapped under the victim's fingernails. It may be used for DNA analysis. Debris should be placed in white folded paper and then placed in packets marked Step 4. A collection stick is enclosed within the packet. Use it to perform the fingernail scraping. The scraping should be done very gently as to remove loose debris only and not the victim's nail bed tissue, which is rich in the victim's DNA. Do this over the paper. Drop the collection stick in also. Refold the paper. Place items in the envelope and mark accordingly. Any suspicious stains should be lifted by placing a drop of distilled water on the stain and rolling the collection swab across the stain. The swab is then placed in the tube. Remember, each item of evidence collected in Step 4 must go into a separate envelope. Accordingly, the kit has more than one packet for Step 4. If the system provides for it, ask for a photographer and take the photographs recording the injuries. If any are found, describe the injury or injuries on the physician's examination form.
सविता, एक सवाल का जवाब दो मेरा। उस आदमी ने तुम्हारी छाती को मुंह लगाया था। मैं तुम्हारी एक छाती से जांच लूंगी, कोई परेशानी की बात नहीं है।
If the assailant's mouth contacted the victim's breast, place a drop of distilled water on the nipple area and swab with the collection swab. If the assailant is a secretor, which means he secretes evidence of his blood type into the saliva, semen, and other body fluids, it is possible to determine his blood type and possibly DNA fingerprinting by collecting dried saliva from the breast. Remember, the envelopes are self-sealing and should not be moistened or licked by the physician, as this may contaminate the evidence with the doctor's secretion. It is now time to begin pelvic examination. Please remember, if the victim is a minor and resists examination, or if she is bleeding profusely, the medical examination must be conducted under anesthesia. This instruction is not to be ignored under any circumstances.
ये कंघी देखती हूँ। इस कंघी से मैं
The
सबसे पहले
first
तुम्हारे
step
बालों में
is
से
to
जांच
comb through the pubic hair with a plastic comb. Place the collection paper under the victim's butts and gently comb through the victim's pubic hair. Loose or foreign hair will drop onto the paper. The comb is then placed on the paper. The paper is folded and put in the envelope.
अब मैं तुम्हारे बाल थोड़े
Clip
काट
several
के
hair close to
आगे
the skin
जांच के लिए भेजूंगी।
and place the
बिल्कुल
sample
परेशान
on the
ना
collection paper.
चिंता की कोई बात नहीं है। Just relax.
Pubic hair, which appears to be matted or stuck together, may contain seminal fluid. This area should be clipped close to the skin and submitted in the packet for matted pubic hair. Since this is the last step requiring scissors, they may now be discarded in the waste disposal container. Now, carefully examine the vulva for signs of trauma. Red discoloration representing bruising. Tears of the posterior fossa and bleeding from the hymen are examples of the kind of findings you may come across. The kit contains slides that can be closed shut. One is marked C for cervical and the other V for vaginal. These are for making 2 wet smears which will be examined for the presence of spermatozoa. Cotton swabs and brushes are normally used for retrieving spermatozoa and protein markers from the vagina and cervix. Cotton swab appears to be the most effective vehicle because they provide the highest DNA material for analysis by common methods. The swabs are contained in their respective tubes labeled C for cervical and V for vaginal.
अब मैं तुम्हारी औजार से अंदर की जांच करूंगी.
Care must
कोई
be
परेशानी
taken
नहीं
while
होगी.
inserting the speculum,
आराम से लेटो.
as the victim may be tense and vulva may be sored as a result of the assault.
Relax.
The vagina is carefully inspected, and using the vaginal swab, a sample of the fluid from the posterior fornix is collected. The swab is then used to make a wet smear. Prepare the wet craft by rolling the swab across the slide. Seal the swab by placing it in the tube or box labeled vaginal swab. Thereafter, place a drop of saline in the center of the smear area and cover the slide with the cover slip. Retrieve the swab from the tube labeled cervix and collect fluid and mucus from the cervix. This swab too is used to make a wet preparation as with the vaginal fluid. Since the cervical mucus may be thick and difficult to get onto the slide, the cover slip is sometimes used to ease the mucus onto the slide. The swab is then placed in the tube labeled cervix. Don't place the step 9 slides in the envelope. They will be examined for the spermatozoa immediately after the examination is completed. As a service to the victim and for possible use of evidence, tests for gonorrhea and chlamydia are taken wherever possible. Usually a chocolate agar plate and gonorrhea transport kit are used for this purpose. A sterile swab contained in the kit is rotated in the endocervix and used to streak only 1/3 of the agar plate. This swab is discarded and the plate is labeled and sent to the hospital lab. The lab will complete the streaking of the plate. Please note, step 10 is the only step where swabs are discarded. If the cervix is absent, the collection is done from the upper vagina. Washing of the vagina is then performed using the preloaded syringe and catheter. The fluid should be injected into the upper vagina and then agitated slightly with the speculum. Draw the fluid back into the syringe and then place it in the red top tube provided. This will also be examined in the forensic laboratory for the presence of spermatozoa, protein markers, and DNA. The syringe and catheter are discarded. If anal assault took place, step 12 should be completed and culture performed. The anus tool used for the examination consists of 2 parts, a hollow sheet to allow visualization and an obturator to allow safe and easy insertion. It helps to perform the anoscopic examination using lubricating jelly, which is water-soluble. The obturator and sheet should be slowly inserted into the anus and used for carefully visualizing a close-up for tears and contusions. Replace the obturator prior to rotating the anoscope. Inspect all 4 quadrants and, after careful examination, collect the fluid samples with the swab. and prepare wet mount slide. Perform the culture as demonstrated in the previous steps. If the victim was forced to perform oral intercourse, inspect the oral cavity and collect the appropriate swabs and cultures. The areas most likely to yield spermatozoa are the vocal gingival pockets just above the second molar or the interdental spaces. Take care not to induce bleeding during collection. Swabs or interdental brushes are used to collect the samples and they are submitted in the tube. Cultures are then taken. Wet grafts are made of the area sampled and then examined under the microscope along with other slides. Step 14 constitutes of collection and analysis of the victim's blood. Analysis will be performed at the hospital's laboratory. This is done to ascertain the victim's blood type. It is also done as a service to the victim because the blood is screened for HIV, hepatitis B, and also for syphilis and pregnancy. An additional red top blood tube and a urine specimen should be collected if toxicology studies are required. This should be done if there is suspicion of drug or alcohol intoxication. The examination of the victim is now completed and it is time to examine the wet smear slides. Carry all the observation specimens to where you will examine them. The custodial responsibility is yours and therefore do not leave them unattended at any point. Examination of the wet slides is one of the most crucial parts of the evidence collection and forensic examination. You must examine the slides under the microscope for live or dead spermatozoa. Time is of utmost importance in this examination. Spermatozoa stay alive for 10 to 12 hours after the ejaculation. Dead sperms can be seen for up to 3 to 4 days after the assault. Therefore, examine the victim and collect the wet smears at the earliest, and thereafter personally examine the wet smears urgently. The presence of spermatozoa is one evidence that can swing the case in the favor of the victim in the court of law. Prepare the microscope adjusting the condensing diaphragm all the way down to increase the depth appeal. This allows for easy and complete examination of the entire slide. This field demonstrates numerous sperm cells. Spermatozoa may also migrate to the edge of the cover slip area, the so-called gutters of the slide. Make sure these overflow areas are also examined. Spermatozoa head measures about 3 to 5 microns, while the tail measures about 40 to 50 microns. In comparison, an average red blood cell is 7 microns in diameter. This field is negative for sperm cells. It also shows background debris and epithelial cells, WBC, and bacteria. A positive identification of an oval object as a sperm cell is imperative because motility can be simulated by other factors. Take great care to avoid confusion with Brownian movement of trichomonas, as this also causes apparent motility. After completion of the microscopic examination, the cover slips are left in place and the slides placed into carriers. The carriers are shut and placed in the right envelopes. The history of physical form is then completed, showing the results of the microscopic examination. Sketches of trauma or other physical findings are completed. The envelopes are then initialized and placed in the bottom of the kit. The evidence kit is sealed with a tamper prevention tape contained in the kit and is placed in the bag labeled biohazard. Place the bag in a locked refrigerator or under lock and key in a secure area till the time it is delivered to the police authorities. Once you have examined the patient, therapeutic aspect is important for prevention of pregnancy and STDs, including HIV and hepatitis B.
सविता, मैं तुम्हें एक बात और बताना चाहूँगी। ऐसे हादसे के कारण दो तरह की परेशानी हो सकती है। एक तो प्रेगनेंसी हो सकती है, एक संक्रमित रोग हो सकते हैं। हम इन दोनों के लिए तुम्हें दवा दे सकते हैं। क्या तुम ऐसी दवा लेना चाहोगी? इसमें ले लोगी दवा? ठीक है।
Data concerning the incidence of STDs following a sexual assault are few. However, it is estimated that gonorrhea is contracted in 1 in 30 cases, chlamydia in 1 in 10, condyloma in 1 in 4, HIV in 1 in 1,000, and syphilis 1 per 1,000. The incidence for transmission of hepatitis B is largely unknown. However, in non-immune or unvaccinated individuals, immune globulins should be considered. Suggested protocol and dosages against these potential infections are shown here. In non-pregnant, non-allergic individuals, one of the most common and accepted regimens for prophylaxis against both gonorrhea and chlamydia is doxycycline, 300 milligrams orally stat, followed by 100 milligrams twice daily for 3 days. Fluoxetine is also an acceptable alternative at a dose of 400 milligrams twice daily. A little tolerated but more expensive alternative is azithromycin in a one-time dose of 2 grams orally. In pregnant and adolescent, erythromycin is an alternative at a dose of 1.5 grams orally stat, followed by 500 milligrams 4 times daily for 7 days. The risk of HIV infection is small. However, should prophylaxis be indicated, the correct regimen usually consists of triple drug therapy with zidovudine, lamivudine, and nevirapine, or stavudine, lamivudine, and nevirapine. This is now available in the country. The incidence of pregnancy in susceptible victims is estimated as nearly 8 for 100. Prophylaxis against pregnancy may be effective up to 72 hours. Using dedicated levonorgestrel emergency contraceptive pill, the pregnancy rate is brought down to 1 per 100. By conventional oral contraceptive pills, it is brought down to 2 per 100.
ये लो, पर एक बात का ध्यान रखना होगा, ये दोनों दवाइयाँ तुम तभी लोगी जब एक बार तुम्हारी प्रेगनेंसी टेस्ट की रिपोर्ट आ जाएगी। उससे पहले कोई भी दवा तुम्हें नहीं लेनी है, ठीक है?
In order to enhance evidence collection, it may be necessary to employ one or more special forensic techniques. Colposcopy to search for microlacerations, toluidine blue staining to enhance the texture of microtrauma, Wood's lamp examination to enhance the texture of stain or the skin, especially seminal fluid stains, forensic odontology for bite mark casting. Colposcopy is the examination of the lower genital tract using a binocular microscope. By bringing the skin of the vulva under magnification, it is possible to find microlacerations, which will otherwise be undetected. If the victim reports that she has had no sexual activity for several days prior to the assault, and especially if the victim is virginal, microlacerations are a significant finding. Toluidine blue is a stain which assists in identifying small lacerations. The stain is applied with a cotton tip applicator or sprayed on the vulva. The excess is washed away with water. The stain is taken up by the subcutaneous connective tissue exposed if lacerations occur. Thus, these lacerations show up as short lines with staining. A Wood's lamp is a very useful tool in detecting stains, especially semen, which is not easily visible to the naked eye. To use it, darken the room and project the UV colored light across the skin while looking for areas which shine or fluoresce. The Wood's lamp illuminates the surface beneath the skin. The areas which show white or proluminescence are then sampled with moistened swab for later examination in the laboratory. Additional special techniques include forensic odontology, in which bite marks are photographed and 3D casts are made, which may be matched to the jaw pattern of the assailant. The findings of these special forensic examinations should be recorded on the physician's examination report. Now we move on to the second part of our video, age determination.
Age verification of trafficking and sexual abuse victims is mandatory under Section 15, subsection 15A of the Immoral Trafficking Prevention Act of 1956. Age verification establishes whether the victim is a major or a minor, and this has a critical bearing on the outcome of the case. According to the ITPA, trafficking of minors is a more heinous offense, and it warrants much more stringent punishment. Age determination constitutes of 4 parts: general physical examination, examination of secondary sexual characteristics, dentition, and radiological examination. Conduct a general physical examination and secondary sexual characters examination using the age-related data for height and weight for boys and girls separately, and examine the development of secondary sexual characteristics like hormonal changes, axillary hair, acne, menstruation, breast development, the pubic hair, in line with Tanner's indicators of puberty. Dental X-rays like orthopentogram or an OPG will establish the age fairly accurately between the ages of 6 and 12 years. Similarly, radiological examination of bones will give a fairly accurate age estimate by studying the ossification centers of long bones. A thorough dental and radiological examination can give correct age estimation within ±6 months. The age determination test should be conducted for all traffic victims referred to a medical officer for a medical report, whether or not the investigative agency has specifically requested for it or not. Never rely on a single method for age determination. A combination of methods just discussed should be used. The medical legal report should be submitted to the investigative officer within 48 to 72 hours of conducting the examination.
Currently, there is no prescribed format for interviewing the victim or for writing the medical legal report. It is advisable to follow a prescribed standard format. We are in the process of mounting an IMA website that will provide a prototype, the standard format for legal consent, for medical interview and medical legal report online. In collaboration with Department of Women and Child Development and UNICEF, IMA has developed a manual for medical officers dealing with the child victims of trafficking and for commercial sexual exploitation and child abuse. This document provides guidelines for the medical officer to discharge their statutory responsibility of medical examination and age determination. This manual too shall be accessible online. The standard toolkit presented in the film is a very low-cost tool. The details of this kit shall also be available on the IMA website. Medical officers and hospitals can adapt this kit to their own needs.
We now provide you with a brief summary of all the steps involved in conducting a thorough medical examination. Step 1. Obtain victim's consent. Step 2. Obtain the victim's history and record all the information on the physician's examination sheets. Step 3. Obtain the victim's underclothing and place them in the appropriate bag and label. Step 4. Perform complete body surface examination and collect any foreign material. Perform fingernail scrapings if indicated. Request photographs if indicated. Sketch findings on the examination sheet. Step 5. Collect secreted test swab from victim's breast if oral contact occurred. Step 6, 7, 8. Collect, comb, clip matted hair samples with the enclosed scissors. Step 9. Perform a pelvic examination using a speculum and collect wet slides and swabs. Step 10. Collect cultures. Step 11. Collect washings of the vagina. Step 12, 13. Perform oral and anal examinations as indicated by the victim's history and collect wet slides, swabs and cultures. Step 14. Collect samples of the victim's blood for forensic and clinical testing. Perform additional forensic techniques as indicated, such as colposcopy, toluidine blue staining, Wood's lamp examination, bite mark impressions. Examine the wet mounts for spermatozoa, pack, label and sign the evidence envelopes and place them in the kit. Seal the kit with tamper prevention tape to be forwarded to the forensic lab. Dispense prophylactic medications if indicated and desired.
My colleagues here have just presented to you the standardized methodology of medical examination, evidence collection, and age determination of sexually abused victim. Let me recapture the premises we started with. First, the conviction rate must be raised to prevent sexual crimes. Second, for conviction, high standard of proof is required by the criminal justice system. At this point, prevention of sexual crimes is very, very high on the national agenda. Rape crisis centers are in the process of being set up throughout the country. As the governments set up these dedicated centers for the victims of sexual abuse, more and more doctors must equip themselves with expertise in forensic examination. We of the medical fraternity must ensure that no perpetrators of the crime go scot-free just because of lack of training of doctors and because of the badly conducted medical examination.